Well, hello, this is Jeff Block with PotentiaMetrics. I'm the VP of Technology and Process, and I want to give you a quick demo of an application we've developed to help gather information, both clinical and patient-reported, from patients and doctors and their caregivers. You can log in either with social media or register right on the site, accessing a system of an overtime set of questionnaires. Just to give you sort of a quick flavor of those questionnaires, you can see that there are different types of questions that can be completed in different ways. It's pretty flexible. You can, use multiple mechanisms to complete this. You also have the ability to move forward and backwards, see your progress, and so forth. Some questions are required, other questions are not, etc. So one of the things that's most powerful about this tool is the concept of branching logic. Within the various questionnaires, you can show questions or hide them based on the specific answers to former questions. So this user uses tobacco, so we can see that the screen literally changes over time. We've completed the questionnaire, we say we're done, and the system stores that, adding to this person's profile over time. I want to show our text messaging capability because this is a very important and powerful way to interact with a patient. So if I were to start this SMS check-in, it's going to send a message to my cell phone saying, hey, I have a couple of quick questions for you. You can see in this example that there's a part of this that's on the screen on the web page and a part of this that's on the mobile phone. If we had configured this only to interact with the SMS, it would just simply have popped up a text message with no preamble and no web component. So we have that flexibility to do both, either, neither, etc. Maybe I'll say, my name is Jeff, and meanwhile, on the mobile phone, I'll say, I'm 27. Well, in the background, the application will be updating these responses and adding them to the longitudinal data. Here we have a second question. How many siblings do you have? Well, I could say I have 3, which means 3 to 4. I have 1 to 2 siblings. Any of these responses would work. And just to give you an example here, what is the date of your last doctor visit? Well, if I enter the word elephant, then it's not going to know what that means. It's going to say, you need to answer that question with a particular format. Again, there's monthly interactions that could happen here. This is a series of questions going to happen every month. You can set specific times and so forth. And just quickly, I want to show you the administrative console. Here's the questionnaire management screen. So here's where you get a clearer picture of the timeline. You see that these are powered on, they're active. I could remove that, let's see, the clinical assessment from the timeline, which means that it is no longer going to be asking this timeline, but the questionnaire is not deleted. Similarly, I could go in and edit it, which allows me to change, move around in the timeline, or upload and import questions with this highly complex branching logic and so forth that's done behind the scenes. MyPROSE supports an unlimited number of scripted engagements over time. Questionnaires can be scheduled to be sent out every day, every other day, a month from now, every 30 days. MyPROSE stores data in a secure, HIPAA-compliant data vault to ensure that the data is safe and always available. MyPROSE is also affordably priced, with each patient engagement costing as little as pennies a day. The ability to longitudinally capture the patient's voice gives providers unique insight into their patient's experience with care, their quality of life and functioning, even after the patient leaves the healthcare facility. Here's an example of a 54-year-old female patient discharged from the hospital 1 day after surgery on her hip. The chart shows the patient's pain on the y-axis and the number of days on the x-axis. The ability to monitor a patient's experience over time could provide the necessary information to alter the post-discharge care plan, improving the patient's care and satisfaction. As you can see here, the patient's pain levels were exceeding the levels reported by similar patients. This provides clinicians with critical information, resulting in prescription of a different oral pain medication and increasing the use of cold compresses to mitigate local swelling. Leveraging both domain expertise and technical proficiency, PotentiaMetrics has developed a unique patient assessment tool. MyPROSE can improve response rates, data quality, and the patient experience while collecting unique patient information that improves care and lowers cost. Thanks for watching.